Hello and welcome to Wellness by Design. Today, I'm your host, Jane Hogan, the Wellness Engineer, and I'm so excited to welcome Dr. Kim Duramo to the show today. She is just aligned with my heart on self healing and mind body medicine and all these beautiful techniques that I know work. And you're a medical doctor as well. So, that combination is so unusual and so beautiful. So, welcome to the show, Dr. Kim.
Thank you. I'm so glad we met. I'm really excited to connect.
Me too. Me too. So, so as a medical doctor, you were taught, this mind body stuff. How did you, how did you switch over and why did you switch over? Was there something, and something that happened in your life? Like what took you down this path?
Yeah, it actually came first. So before I was ever inspired to go to medical school, I had a really powerful awakening experience when I was younger. I had already been very empathic and intuitive, and that just got really heightened. And I was aware of what other people were feeling, what they were thinking. I could feel that connection and was aware that we're not separate, that our body is not really what we are. We're operating through the body, and that we can allow different brain states that allow us to be more receptive to intelligence, to information, to solutions. And I began to see that what we're looking at calling disease is actually just a manifestation in the body, pointing out where there's an underlying discrepancy in our beliefs or where we've cut ourselves off from source. And so the big thing in my work is that when we open back up to source, we soften the body, we get more receptive, we go to surrender. There's more life force that flows through the body. There's more current and more energy, and the body works totally differently. We're not meant to live in that contracted state or that stress physiology. And when we let that go, so much changes and so much healing happens.
Oh my gosh, expressed so beautifully. I mean, it's exactly how I feel as well. And actually, you know, all the science and all the ancient wisdom actually tells us this is true. It's not like, oh, this is a nice thing to believe. We know that it is actually the way it is. But we've got like a society paradigm that's not there yet. Right? So, and also like I'm sure in medical school you weren't talking this kind of talk, right? So, how did you like merge this together?
Well, when I applied to medical school, one of my friends told me about osteopathic medicine, and I had never heard of it. And I grew up in Boston. So it was really important to me that whatever kind of doctor I became was going to be acceptable in that area. And like this was something that people could do. So I looked up online, and there was a DO right across the street working at Children's Hospital. So I was doing research at that time in a lab, one of the Harvard labs, and he was right across the street on Longwood Avenue. And I spoke to his secretary thinking like, they'll probably tell me you can have 3 minutes 2 weeks from Wednesday. She said, "What are you doing at lunch today?"
Huh.
I was like, "Oh my god, come over." And he gave me like an hour of time. It really answered all my questions about what this was. And it was just like a ding, 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 ding from the universe. Like, yep, this is your path. There was a complete and utter certainty. And it was kind of a synchronicity that I even got to meet with this guy. And he was one of the heads of pediatric surgery at Children's Hospital. And it just couldn't have put the exclamation point on the end of the sentence any more perfectly for me. I knew that that was my step and that was what I would do. So in medical school, there was this other component of understanding that the body heals itself, that the mind and body are connected, even though most of the medical training part was pretty conventional and was in like the mainstream. And I went on to do a residency at Grady Hospital in Atlanta in emergency medicine. So I was at Emory University, very, very allopathic residency, but it actually fit into the picture for me because I gained the capacity to be really, really in a centered, steady space and maintain that in the midst of some of the most intense experiences that I've had, that others were having. And it really greatly enhanced what I'm ultimately here to be doing as a doctor.
Oh, yeah. I mean, you got to be in the moment, right? In those emergency situations, which is a big part of mind body medicine, really, right? Is being in that moment. And did you have times when you felt like sort of that divine, like speaking through you in those situations?
All the time. I mean, especially when applying for a residency, because a lot of people were really skitzed out over, you got to do this and you got to do that and you got to make sure you get the right residency. And I just always kept remembering, nope, I'm not subscribing to that. I'm guided. It's okay. Because I felt like the agitation with that. And I always just knew like, nope, let that go. Dump that. You'll have what you need. Your path will be there for you. So I remember applying, and in my head, it was like, "Oh my god, am I gonna get this? Like, this how they only let certain amount of people in." But there was such a knowing, and that's the thing that happens is when we're connected to our heart's desire, which is not the same as the ego desire, there's a knowing. This is who you are. The doors will be open, and the more you connect with it, the more you experience the doors opening, the path being smooth, the clarity being there. So whenever there'd be moments of stress, I would go back to that and thankfully had developed that to enough of a degree. So I remember I applied to that one program. I got into that one program. It was kind of like divinely intended. And I also felt that during that whole 3-year training, a lot of the experiences I had, I was supported. Things worked out in a way that I saw they didn't really work out for other people, that they would most of my colleagues were on antidepressants and anti-anxiety medications. I found a great homeopath who like helped me through all of that. There were situations where I'd really have profound connections with people just within moments of meeting as my patients or even other colleagues. There was a because everyone rotate through the ER. So there was one guy who was a psychiatry resident. And you wouldn't think, what are you doing in the ER? But in that first year, you've got to learn general medicine. So they'd go through, family practice, internal medicine. They'd come through the ER. And this guy was scared to death. And I remember just looking him in the eyes and saying, "Come here." And we went into the residence lounge and I just looked him right in the eye and knew exactly what was going on for him and was able to just get him back in his body and say whatever needed to be said. And he just started crying and he's like, "I've never told anybody how I was really feeling. How did you know that?" But if you let yourself be sensitive, it's so easy. It's so apparent. I'm like, who are you kidding? So I did find I'd have moments of really profound connection and meaning when I would stay in that space, which you'd think in the ER, it's like the opposite. You're just in this fight or flight frenetic, but it was exactly the opposite. It required that I get more in my body. It required I get more connecting with my knowing instead of trying to figure it out from the mind. Cause you can imagine you're like running a code, someone's dying, and you're trying to calculate the dose of like epinephrine. You're like, ah, you see people like audition for a show and they forget their lines in the middle of it because they're so on the spot. So you could never operate that way and be successful as an ER doc. You have to. And I saw the greatest ER docs I worked with. I saw them doing this. I saw them like just avidly standing in a core connection of allowing their deeper wisdom and acting upon it. And they'd all developed that intuitive, that they wouldn't have called it that, but that intuitive capacity. So it ultimately really served my ability to trust my knowing, to honor my intuition and choose it. So I know ultimately it was like part of that divine plan for what I'm ultimately doing, right? Because I have to trust myself fiercely and I've got to connect deeply because it's no joke. If someone's dying of cancer or has MS or whatever's going on, and you want to look at what's true here, what needs to happen, what does she need to know, what is this about? You can let that intelligence come in, and you've got to have a deep connection of openness and receptivity to it in order for that to happen.
That's really beautiful. And it sounds like, I mean, because I've always had that like I know how people feel all the time without even, they don't have to say anything. I just sense it. But I kind of ignored myself for so long until, I got rheumatoid arthritis. And that was like the smack, like the wake up call, right?
Mhm.
To let me know. you're not paying attention. And since I did start paying attention, everything changed. I'm really honoring. I love the way you talked about desires there because the step, I've got a 6 step process. And the first step, it's called the design blueprint, but the first step is D, desire. And I talk about the difference between ego desires. You know, people think that they want a big house or a car or whatever. Those are the ego desires, right? But the desires that come from the soul are totally different. And those are the ones that um, make the yellow brick road like open up in front of you, right? When you tune into and
Yes.
so
Well, and you also see that they're on the surface totally different and then deep down totally linked. Because the reason that person thinks they want a better car or better house or whatever is they wanna have some sense of joy or they wanna have some sense of, like a self they might say like, "Oh, I feel wealthy," or "I feel security," but what they're really looking for is that serenity of like a confidence of, "It's okay for me to celebrate who I am." And so they might, once they have that connection, don't not even care about the house anymore, not even care about the thing, or have like an even clear idea of what that would really be. And it comes in because it supports that deeper sense of self.
yeah, and because all we're ever really after is a feeling, and so we think the things are going to give us the feeling. But I mean, do you talk about creating your own feelings? How do you
Yeah,
tell
so
people?
so it's about, getting into the frequency of that experience, and whether the experience is like, I want my loved one to be healed and not die, or it's I wanna manifest the home of my dreams, like, it could be anything. You wanna get into the frequency of it, and you wanna let that in cellularly, so it's not just the idea, it's the sensual experience. That's when you feel like the tingling, "Oh my gosh, this amazing thing, this incredible, I'm so grateful, I'm so joyful." When you activate that frequency of gratitude, that's the receiving. You're already receiving it. Then you allow it to be received on all of the other levels. So that's such an important practice.
Ah, love it. I love it. So, how do you work with patients now? Like, how do you weave this into the work that you do now?
So, I've created programs where I do like groups, and people will work with me either for one is called Embracing Health, where it's over the course of a year. We do this really deep integration cellularly in your nervous system. You're allowing powerful regeneration of just everything you think about who you are. We've got to change that at the foundational level before you can really let real change in. And once you release the attachment and the identity, or even just softened around it a little bit, you can let unthinkable things come in very quickly because you're no longer hanging on to this rigid idea of who you are, which then creates the inflammation and recreates that nervous system
Body.
and all that chemistry, yeah, of how you hold yourself. So once you soften around that, the healing can happen right away. And the more you practice it, you're now being that self who's free and being that self who's supple and receptive. And that lets the change happen.
Mm.
Excuse me. So I found that's like the essential component because no matter what I'm saying, it won't go in if you're holding those ideas. Like you're in a high beta brain activity, you literally can't let in new information. We could go 20 years of therapy in that functional system and we really would get nowhere. But if we can drop you into your body, into a low beta, alpha, delta, theta, which is even slower brainwave state, that's where I go when I work with people and do healing work, is that deep theta brainwave state. And that's where like massive shift, quantum shift happens very quickly.
You probably follow Joe Dispenza too, right?
I have, yes.
So yeah, he's all about those brain waves. And so, do you have tools where you measure people's brain waves?
Um, I'm not measuring their brain waves with like external technology, but I can tune into their body. And it might sound a little weird at first, but you talk to people and you can tell if they're like, "Hey, how are you? Oh my gosh, everything's good." And they're in that high beta, which is actually a very suppressive state. They're suppressing sensation. They're not even aware of how they're doing. And they're in a program of, if I say this, this is how I'm supposed to do it. So you can feel that. It doesn't take a lot more to develop the sensitivity to then feel like, where is this person functioning from? So if someone is functioning from the conclusion like, oh, I'm a woman and therefore I'll always have to work harder, or, oh, the older you get, stuff's gonna fall apart. You can feel the frequency of those conclusions, of those states. It's a brainwave state, it's an emotional state, and let yourself have that awareness. And then it's just a matter of, you know, noticing, okay, what's tied? Why is this person's MS getting recreated and recreated? It's not going away. Why is the cancer getting worse? Why is whatever the illness is, rheumatoid arthritis manifesting? And then you can let yourself know, oh, there's this in the system. There's this belief, or there's this foundation, or this identity, or there's so much fear that the person's system's all clamped up.
Mm.
And so when I went through medical school, I developed an autoimmune disease, and it was like a rheumatoid arthritis kind of related disorder. Um, I knew there was something wrong, but I also knew that wasn't exactly what was going on. So I had to really investigate for myself, and it required me to finally let go of trying to heal and just deeply listen. Body, what do you need to show me? Because I was not receptive. I was like, we got to get on with it. We got to get better. I can't be tired. And when I finally surrendered, it was so clear. It was like, how the heck did I not see this? That I had been in this fight or flight pattern of improving and overcoming and achieving. And it was a heart's desire to go into medicine and to create this, be of contribution. But then there was this massive layer of like, I've got to be good at it. I've got to do the right thing. I've got to, I got to make sure I don't fail. So as long as that layer is like a splinter in the system, you got to pull that out.
Yeah.
And then the resolution happened. My body was no longer inflamed. I was no longer on this race to outrun failure. I allowed the moment in, and I trusted, like, there's already greatness in you. You can let that just ride out, and you can let that show you where you're going, and it's going to create that success. And the small self me didn't need to heal my body, and the small self me didn't need to create success. And I finally just let that go. And that's really what let my body heal.
It and the surrender is a key step, isn't it, to this process, which is so hard for us to do. What strategies do you have for helping people?
So in the MindBody Toolkit, I wrote my book that I actually put this together because I was in that state where I was so sick and I knew my body heals itself, my mind and body are connected. WTF, like, get it together. And I realized, because I'd studied this stuff for years and years and years, but it was like, well, what do I do with that? How do I activate that if that's what's going on? So when I did my book, I shared those tools, like what actually created, what is surrender? How do you surrender? So it's 10 tools you can use anywhere, anytime to open and allow that activation. And so it's things like, well, one of them is just your physical body. How am I holding my body right now? And if I soften my body, like every time there's rock in a hard place, or life just looks like a cluster, and you're like, ah, I always remember, oh, wait a minute. Nope, that's just life reflecting my tension. So I let go of trying to make anything better, and I just soften my body and I breathe. And sometimes immediately it's funny, but sometimes immediately it just sucks more because I'm feeling it more now that I'm not resisting. But I just let it all in.
Yeah.
I soften my body. I let the breath come. I say I'm willing to move through this experience, because this is a big frequency shift of, I'm in this experience and I got to get out of it. I got to make it better. I got to get to a higher frequency, or I'm in this experience and I'm willing to be in this experience.
Mm.
That subtle shift is a massively increased frequency, right? Resistance versus 2% less resistance. I choose to feel as crappy as I feel right now. It releases a ton of resistance. And sometimes I'll feel a whole lot better immediately, or sometimes I'll just feel the badness more and just welcome it. And within minutes or sometimes maybe a little longer, it will shift and like miraculous things will show up like I could have never imagined happening.
That's really powerful for people to hear that it can, like initially, just because you're noticing it, it can feel worse, but then there's a release. There's always a release.
Yeah, it's gotta be an unconditional surrender. It's not like, "I'll surrender, so now it feels better," right? I have a 5-year-old. My 5-year-old, if we were searching for something he dropped in the woods, and I was like, "You know what, Gianni? Let's just practice gratitude." And he goes, "Yeah, yeah, yeah, mom. Do the magic, do the magic." I'm like, I'm so grateful and thankful that this all worked out. And he's like, I'm so grateful and thankful. And then he's like, well, where is it? Where is it? And I realized in that moment how funny it was because I had some attachment too. I really wanted to find. He dropped this little flashlight that came with his little costume. And I realized, oh, I need to be grateful and thankful for the experience, no matter how it turns out. Grateful and thankful that we find it, grateful and thankful we didn't find it, but maybe something even better. Cause I realized like there's a lesson in it for him that, well, I guess like taking better care of your things and not dropping them. But I think the lesson in it for him was to be in more flow with, like, non-attachment. I mean, he's 5, so I get you're not gonna necessarily, have all the wisdom in the universe in one moment, but he's a pretty freaking smart kid, and he did begin to see that the attachment was not serving him, and he did begin to see that sometimes it doesn't go your way, and that one I mean, that's a huge some people don't have that at 45 years old.
Right.
I realized that, the gratitude has to be like, I'm unconditionally grateful for however this goes, and that's one glitchy thing I see when people are trying to heal. "I'm practicing the tools. Why isn't my pain going away?"
Yes.
"Oh, you think you're in a little attachment right now? You think you see the resistance?"
Yes.
And, you have to have compassion for the human.
What a great lesson. I mean, we know so much now about, up to the age of 7, we're just, sucking in all these programs. What a great lesson for your son to to get that lesson of it's like we let go of the outcome and be with whatever happens.
Yeah.
Okay, so that's great. So you mentioned you have some other tools. Do you want to go over any others?
Sure, sure. So one of them actually that I've seen to be a big portal for like shifting your frequency when things are glitchy or it's a conundrum or why is the pain not going away? Right? Maybe you get another diagnosis. I know for me, the more I tried to heal myself, the more complicated diagnoses got thrown my way because it was like getting worse. And so getting curious is a really big portal. So you just go from this is hard. I don't know what to do to I wonder what might be possible that I haven't considered. I
Mm,
wonder how this could be serving me. I wonder what bigger thing is happening here that's actually creating something I could have never imagined, right? Because like for Gianni or for me with the flashlight thing, I wanted to find it. And then I let go and realized, am I doing conditional gratitude? Let me be more grateful. And then we'll find it in the it was pretty tall grass. It was gonna be hard to find. It's needle in a haystack. But I knew it was possible, but I had to release having to have it that way. And so curiosity, like, how could this be serving my son that we don't find it? How could this be growing us both? How could for me it was what's right about this I'm not getting when I was so sick. And as soon as I asked what's right about this, because if your body's on your side and if life's on your side, like
gonna
what
say,
would this gift be? I've seen people heal. I had one kid with RSD, which is reflex sympathetic dystrophy, where the nervous system. She had this very, very minor injury, and it was like as if she'd fractured her ankle in 3 places, severe pain, and it didn't get better. It actually gotten worse as she went through time. It got significantly worse, and she had seen multiple pediatric specialists, pain specialists, orthopedic specialists, several admissions in and out of the hospital, months and months and months sleeping on the couch. She couldn't get upstairs to her room. The whole family's lives completely revolved around this illness. And when I asked her, she was super smart, so she was receptive. I said, "Hey, if this was serving something," I said, sometimes the unconscious is actually just trying to get our needs met. If this illness were serving something, what would that be? And she told me like 4 things. Well, I really hate school, and this is kind of nice. I haven't had to go back. And I really have this and this and that. And she gave me like 3 or 4 things, but I could feel like there was one more big nugget. So I said, okay, maybe there's something else. What else would it be? And she told me, well, my sister isn't mean to me anymore. Like,
Wow.
you could feel this huge opening in her system. And what I felt, the sister was older, and there was this young child was, she was like 11. She was very, very empathic, and she had learned to suppress her emotions, and she had learned to hide what she was feeling. And the sister was like, "I can't believe you did that. Blah, blah, blah. Come on, get the ball. Why did you drop it?" And being tough. She was doing it out of love because she had learned, like, get some toughness, and I think she was trying to, like, help her sister out, but it was shaming and it was embarrassing, and this kid felt really doubling down on suppressing her emotions and hiding her feelings. I said, "Had you ever let your sister know how much that hurt you?" She said, "No, I never let her see." And that's when I saw the pattern in her system. I have to suppress my emotions. I have to hide what I feel. And so what she was doing as an empath was trying to make herself less sensitive, because it's like, "Oh, this is a liability. This is not okay. I've got to not be too sensitive," which was not the truth. And so really her life's purpose requires that level of sensitivity. And it was like, no way. We're going to get rid of this pattern, and you're not going to take this on. So it created this massive, massive blowing up of an illness to get her attention to see what gets created when she suppressed sensitivity, so she could finally begin to tell her body, it's okay to have your feelings, and it's okay to ask for what you need. It's okay to show how you are feeling and ask for what you need. And when we shifted that in her system, all the energy released, and the RSD, all of her pain completely dissolved. And that night she went up the stairs and slept in her own bed. The next day she came down the stairs, she took a bath. The first time, she within a couple days was back at school, told her mom, "I want to play volleyball." Like, she was jumping around like a kid again.
It's amazing those things that we hang on to that like have a real physical effect on our body, right? Like they're
So
emotional.
she was swollen. It wasn't just, "I think I have pain." Like, there's real
Yeah.
physical inflammation, joint degeneration, which for her was not the case, but for many people, you're gonna see degeneration of joints. You're gonna see the thyroid function is down. You're gonna see the adrenal function is shot. You're gonna see it in the labs and the studies.
Yeah. Yeah. So interesting. I know people are going to wonder, did your son find the flashlight?
Not yet.
Not yet. I like that. I like that. So I know that EFT tapping, right, is part of your protocol. So you want to talk a little bit about that?
Yeah, EFT tapping, and I did this with that young girl that day, and was minutes that this unwound. It's one way, once we kind of get to that root and we see what's going on, to allow the nervous system to release those patterns. Because even if, major trauma for years and years, and things get instilled, and the neurons that fire together, wire together, your brain is neuroplastic, and it can allow very significant shifts. It doesn't need to take a long time. Different people will say different things, but I have seen this happen very, very quickly. It all depends on the level of compassion you're holding that allows the release of those dense energies and the shift to happen. And so if we gently tap on the meridian points, it is opening those meridian channels, our meridian nervous system, I think of it like the third nervous system. We have our, regular somatic nervous system. You pick something up, you have intention, you're voluntarily using your body. Then you have, and the other part of that is your involuntary. So the your heart is beating and your blood vessels are constricting or dilating and your kidneys are detoxifying. So you have this other piece that's more of a involuntary. And then you have your meridian system. And in your meridian system is where these channels are located. We've now anatomically dissected out these meridian channels. It's not really a part of Western medicine, but obviously extremely important in Eastern medicine that we'll open and clear these meridian channels and then see the health of the body improve physically, mentally, and emotionally. So when we tap on these points, it's helping to clear out whatever's holding up those meridian channels, those pathways, because it is actually energy current. It's not like physical sludge. It's energy current. It's resistance. It's static. If you think like static, it's got to hold the energy current in a certain alignment. So we just kind of like discharge the static. And there's different points on the body. You could pick one of them and just, even if sometimes I have people put their hand over their heart or tap on the heart, say, okay, it's okay, body. It's okay to be scared. It's okay to have this pain, and breathe in, breathe out. I love and accept myself fully. And you'll allow a discharge through that nervous system and improvement of physical, mental, and emotional well being.
It's so powerful. The first time I tried it, I remember I just on particular statements was just like bawling. Um, I think it was something like,
Oh, yeah.
I've been hard on myself for far too long, and I was just like, and all came out because it was true, right? Those statements where we get very emotional, usually the truth statements, the truth bombs. Um,
Yes. People will often say, like, aren't you tapping on the negative? If you tap on, I'm scared, aren't you affirming a negative? It's not that. It's really, like you said, the truth. Once I call out the truth, but in a space of acceptance and compassion, that's all that's needed to let it move.
So beautiful. And I've heard some schools are teaching kids tapping now, which I think is beautiful to give because it's a resiliency tool, right? And for people to little kids to learn this and have that, I think it's just fabulous. Okay, I know we're coming to the end now, and I always ask my guests, what's one thing someone could do today that's going to begin to create that healing environment in their body? What would you say, Dr. Kim?
One thing that's most powerful is start choosing to accept what is happening right now, whether you're in severe pain or you're in like a deep depression or there's so much fear. Can you breathe and be with that sensation, that emotion or thought, that circumstance, the actual experience? Because it's going to be it's a physical, mental, emotional energy. You're feeling it, you're living it, you're seeing it, you're emoting about it. Can you be 2% more receptive to welcoming it? Because the thing that keeps pain in place and the energy doesn't move, it becomes chronic and it's stuck is we're holding tension there. We're in resistance to letting it move through. But if we would actually welcome it, the energy can move through. And it's just surprising sometimes how resilient the body will be and how quickly things can heal. But we have to start with this now moment, not when I feel better, then I'll relax. Oh, once I get this together, then I'll enjoy myself. It can't work that way because everything's reflecting your state of being. So, yeah, are you willing to be 2% more receptive and allowing and welcoming of what's here?
I love that 2% too, because it's like so little, you're not asking a whole lot, just 2%. So who could say, no, I'm not willing for that just 2%, right? We can agree to that. And so that's just like getting that little wedge in, right? To start.
Yeah, that little quantum shift creates a huge physical shift. So, just 2% more willingness creates like huge more amount of abundance.
Yeah. When we That's so true. At the quantum level, it's we can affect such big changes, right? So, and a lot of people don't realize that. So I'm really glad that you brought that up. Where can people find out more about you? What's your website, social media, and so on?
I'm at drkimd.com. And the book is a great place to start because just really user friendly. And there's the tools, they're kind of a go to, is at drkimd.com/book.
Yep.
I am on YouTube at Dr. Kim Duramo. We do a weekly MindBody TV broadcast. It's live on Wednesdays at 11 a.m. when we broadcast it. It's also broadcast in the MindBody community in Facebook. So if you're in Facebook, our coaches and assistants are there to help people through this work. And then there are online programs, home study programs to assist people in doing this integration. Or twice a year, there are opportunities when I work with groups live to bring them through this for yourself and do the work with you.
Mm. I love it. Thank you so much. And we'll have all those links here, but so generous of you to give people a copy of your book. Thank
Thank
you.
you. I'm so glad that we got to meet. You're
Me
so
too.
beautiful and glowy, and it's great to be connecting.
I love knowing there's other souls out there, and there's more and more out there that are embracing mind body medicine and really um, empowering the individuals, which is what I feel like this show is about. It's about empowering each person in their health. So, thank you so much for being a guest on Wellness by Design today.
Thank you.
Thanks to everyone watching and listening. And you leave a comment, share this with someone who needs it, and make sure that you follow us as well. Thank you so much, and have a great day.